There are two ways to position the instrument console. If you have a bowl, it's nice to have the joint here. And this also gives the assistant a little bit more space to move. And other option is to have joint over here, especially if you don't need a bowl. And best thing is that after you're done with the patient, you can take the console here, patient can leave, and at the same time, assistant can start to prepare the instruments for the next patient. One thing good to notice is that these arms also bend sidewards. That gives you the freedom to place the console exactly where you want it. The instrument console should be so light to move that you can move it with one hand, but it should still be so stable that it stays where you leave it. If you have any problems with the instrument console, you should ask your technician to adjust it next time they come to visit. Behind the instrument console, we have quick connectors for each instrument, so it's actually really quick to remove the unwanted instruments. And of course, by having only the instruments you are going to need, it will be a lot quicker to clean between the treatments. You can also freely change the order of the instruments on the console. Only thing you need to notice is that syringe always stays on the left. And then these removed instruments can be used on other dental units in other rooms of the clinic. There is something good to know information about the instrument activation. So if I take the micromotor and start to drive it, Anu can at the same time take the other instrument and prepare it for me. She doesn't need to worry that her instrument starts to rotate. This way you can really speed up the whole process.
When you lubricate the handpieces, so the excess oil goes to the oil cup. The oil cup is good to check from time to time, and if there is some oil, so you should empty and then put it back. You can adjust the distance of the tray like this. You can also remove the tray completely thanks to a quick connector mechanism. And you can place it also in a different direction if you want. If needed, so you can remove the arm mechanism completely. So for example, if you have a patient having a pacemaker. You can modify the existing user profiles by pressing the pen icon. You can modify the name, language, and the color theme. You can create a new user from here or sign in as a guest user. On top of the user interface, you can see the battery charging level of the wireless foot control. It's good to know that you can swipe the user interface to view more functions. If you want, you can reorganize the icons on the user interface. First press the program and then here. You can remove the unwanted icons by moving them here. You can add more icons so that you first press plus and then select the wanted icon from the list. For example, the apex locator. Now you can see that you have the apex locator visible in the user interface. There are 6 timers available. You can select the desired timer from the list. You can reprogram the timers as you like. If you have patients who are sensitive to cold air and water, it's good to know that if you have this kind of syringe, you can turn on the heating function for air and water. When you rotate the syringe handpiece, the blue light goes on and the heating function is activated. When you rotate into another direction, the heating function is deactivated. When you have Planmeca Solana operating light, there's an easy way to get the composite mode on. So when you take the polymerization light and put it back, so the composite mode goes on automatically. And if you have our older operating light, by the same way, so you can get the dimming mode on.